the FDA Nightly News. I'm Tanner Cartwright, and this evening we'll be discussing cancer. Cancer is the name given to a collection of related diseases. Cells begin to divide without stopping and spread into surrounding tissues. Cancer is considered a genetic disease because it is caused by changes to genes that control the way our cells function. Now here is William Sherlin, our cancer symptom specialist.
Cancer can cause almost any sign or symptom. The signs and symptoms will depend on where the cancer is, how big it is, and how much it affects the organs or tissues. Some general signs of cancer are unexplained weight loss, fever, fatigue, pain, and skin changes. Though many other things can cause these symptoms, they could be cancer if they last for a long period of time or get worse.
Hi, I'm Madison Ann Gaston, and now we're dealing with cancer diagnosis. How do doctors determine that you have cancer? The first step in diagnosing cancer is having a physical exam and looking into medical history and symptoms. Imaging studies such as X-rays, CT scans, and MRIs are commonly used next to detect abnormalities. Then, doctors may take out a piece of the lump to test it for cancer. This is also known as a biopsy. The testing process is sometimes referred to as pathology. After diagnosis, cancer is staged. Cancer staging describes the severity of the cancer based on the size and extent of the original tumor and whether or not it has metastasized. The most common staging method is the TNM system. Lumps found by imaging tests or physical exams must be sampled and examined under a microscope to determine what they are. Not all lumps are cancer. In fact, most tumors are not cancer. Now back to Tanner, who is now interviewing Miss Joyce Murphy.
Hi, I'm Tanner Cartwright here with Miss Joyce Murphy from Fort Dale Academy. What type and stage of cancer were you diagnosed with?
I was diagnosed in August of 2009 with breast cancer, stage 0.
Okay. Tell us a little bit about your treatment process.
Okay, my cancer was diagnosed through a mammogram, and they recommended that I have a lumpectomy, which I did, followed by radiation, which I also did. The radiation was kind of not a normal radiation where you go for a month. I went twice a day for a week, and then when I was through with that, I was through. It was not a fun week, but when I finished, I felt really good.
That's fine. How was your cancer initially detected?
It was detected by a mammogram. I have had mammograms. I have a family history of breast cancer, and I've had mammograms yearly since I was about 35, and that's what diagnosed me.
Thank you for your time, Ms. Joyce. Now back to our reporter, Peyton Burson, with the tips to help prevent cancer.
Thank you, Tanner. Now I want to tell you some ways that you can prevent yourself from having cancer. You can exercise and eat healthy, keep your water filtered, don't use tobacco products, don't drink, protect yourself from the sun's rays when you're outside. When you notice something strange on your body, talk to your doctor about it, and go to your doctor regularly. That is all I have for you today. Now back to you, Madison.
Hi, I'm Madison Ann Gaston here with Dr. Brandon Sidley. Dr. Sidley, what is the cause of cancer?
Well, in general, cancer is a huge topic. There are multiple types that can affect really any part of the body, but two major causes. One is either carcinogens, something that causes cells to become abnormal in the body, or really the other type is genetics. People can just be born with the genes that are going to cause the cancer to form.
How do you stage a patient's cancer?
In general, well, there's a very specific way to stage cancer, but the general principles is it's staged by location. So it starts, you try to find primarily where the cancer started, and then the farther it spreads really determines the staging process. So usually, initially, you got to figure out if you find something in the body, if you find like a tumor for instance, did it start where the tumor is, or did that come from somewhere else? And then that determines staging, which determines treatment for most people.
How will treatments affect daily life of the person with cancer?
It's a good question. You can break treatments down into kind of a couple of major categories. One would be surgery to remove. Some tumors can be removed, some cancers can be treated surgically. Some can be used with chemotherapies, and those are primarily drugs that try to go attack those cancer cells. Side effects of a lot of chemos are they hurt some of the good cells as well as the bad. It's hard to make them very selective for the bad cells. And then the third really is radiation. And so radiation, they're trying to just kill the bad cells once again, not the good ones. They've gotten much better with that over time, where the radiation beams are very small, they get in very small areas, but they still usually have some systemic. Chemos can hurt a lot of different things. You see people lose their hair because it hurts the hair cells, weight loss, those kind of things. Radiation usually hurts locally, just tissue that's surrounding the area they're treating.
Thank you for your time, Dr. Sliley. Now
There are many treatments for cancer. Treatments depend on the size, location, and how much the cancer has metastasized. Once these characteristics have been determined, the treatment options are presented to the patient and the best option is chosen. These options range from chemotherapy, radiation therapy, and surgery to remove the cancerous growth. These are the most violent cancer treatments, but are also the most common. Other treatments can include monitoring, medications, or even the newest method of cancer treatment, immunotherapy, which actually uses the body's immune system to help fight the cancer. Thank you for joining us this evening for our discussion on cancer. This is Megan Davis with the FDA Nightly News. I hope you'll join us tomorrow and enjoy your evening.